Hi, I'm Dr. Reem Al-Mallah, Assistant Professor of Physical Medicine, Rheumatology and Rehabilitation at Shams University. Today, I'm going to show you how to examine the hip joint. By the end of this session, the student will be able to recognize the different anatomical landmarks of the hip, palpate important anatomical landmarks of the hip, demonstrate types of hip movement and their normal range, identify muscle acting for each movement, perform special tests for the different hip structures. The hip joint is a ball and socket joint. It connects the trunk with the lower limb. It communicates between the acetabulum and the femur. صباح الخير. أنا دكتورة ريم الملاح. أنت اسمك إيه؟
أحمد علي.
عندك كم سنة يا أحمد؟
18.
تسمح لي أفحص مفصل الفخذ بتاعك؟
ماشي حبيبي.
أنت عندك أي ألم فيه؟
لا خالص.
Okay. The patient should be bared from the waist down and probably he will be wearing shorts. We will take a look from front to see if there is pelvic tilting, scars, quadriceps wasting or foot deformity. Then I will ask him to turn around, lift, to see if there is scars or lumbar lordosis. لف مرة كمان. Then I'll ask him to turn back to see if there is gluteal wasting, pelvic tilting, or scoliosis. We are going to assess the patient's gait. It's a very important parameter in examination of the hip. بص يا أحمد، أنا عايزاك تاخد الممر ده رايح جاي، خلاص؟ علشان أشوف حركتك. We are going to assess the weight distribution during the stance phase, the lower limb advancement during the swing phase, the trunk position and movement during both swing and stance phase, the speed, the symmetry, the heel strike and toe off. If the patient had any abnormal gait like an antalgic gait or a Tendelberg gait, I will assess the patient's footwear for unequal sole and abnormal gait. طيب يا أحمد اتفضل اطلع على السرير علشان أكمل الفحص بتاعك. Now we should look beside the bed if the patient is using any assistive aids or adaptive equipment. The hip joint is midway between the anterior sphenic iliac spine and the pubic tubercle, just in this point. We have to generally inspect again for any scars, any pelvic abnormality, any quadriceps wasting, and then we are going to palpate the hip joint. By the dorsum of your hand, you should start to feel the temperature of the hip. You will compare it with the other side and compare it with up and down. Of course, in practice, the patient will be completely bared in this area while we are assessing the temperature. But for now, he is wearing his shorts. Now we are going to assess the tenderness of the hip joint. The lateral hip joint at the lateral greater trochanter and the anterior hip joint in the midway between the anterior sphenic iliac spine and the pubic tubercle. Now I'm going to measure the leg length. بص يا أحمد أنا هشوف طول رجلك ولا لا. The first thing that we be sure of that the patient is lying flat and completely identical in the bed, no pelvic tilting here, and the leg is completely straight. We will start by the apparent leg length. هتسمح لي أنت تطلع التيشيرت عشان لحد السرة. From the umbilicus down to the medial malleolus. The other side and compare. Then we will do the true leg length. I will feel the anterior sphenic iliac spine and ensure that there is no pelvic tilting. From the anterior sphenic iliac spine till the tip of the medial malleolus. Compare it with the other side. Now we are going to assess the movements of the hip joint. بص يا أحمد إحنا هنشوف حركة المفصل دلوقتي. Okay? First you have to ask the patient to do the active movement. You will place your hands under the lumbar spine to detect any movements from the pelvis to the hip. اتني أقصى حاجة تقدر تتنيها يا أحمد آخر حاجة. This is the active flexion of the hip. افرد. أنا هتني بقى يا أحمد. This is the passive movements of the hip. يلا الناحية التانية بقى يا أحمد اتنيها أقصى حاجة. افرد. أنا هتنيها لك. افرد. Now we are going to assess the internal and the external rotation of the hip. We'll ask the patient to flex the hip, flex the knee, and if I want to examine the internal rotation, I will rotate the knee externally, and to examine the external rotation, I will rotate the knee medially. Okay. For the other side, for comparison, flex the hip, flex the knee. This is for the external rotation. This is for the internal rotation. Now we are going to assess the abduction and the adduction of the hip joint. We have to stabilize the contralateral iliac crest and then do the adduction and abduction. Do the other side. Adduction and abduction, normal range till 45 degrees from the midline. هستأذنك يا أحمد ممكن تلف تنام على وشك. The hip extension will stabilize the same side of the hip and do the hip extension. The other side. تقدر تلف يا أحمد تاني وترجع تاني على ظهرك. Now we are going to do a special test, the Thomas test, to detect any flexion deformity in the hip joint. I will place my hand under the lumbar spine to obliterate if there is any lumbar lordosis, and we'll do flexion of the hip. I will see the contralateral side should be lying completely straight on bed. If there is any flexion deformity, here there will be raised over the bed. Do it for the other side. As you see, it's completely lying flat over the bed. Now we are going to do the Tenderberg sign for assessment of the hip abductors. It's very important to see if there is any weakness in the hip abductors. The patient will be standing in front of you. You are going to stabilize the iliac crest with both your hands and feel them, and ask the patient to raise his leg while you are supporting the patient. حط ايدك عليا يا أحمد. ارفع رجل واحدة. I will feel that the iliac crest is elevated up. نزل رجلك. ارفع الناحية التانية. نزل. A positive test that the iliac crest drops down, not raised up, indicating that there is hip abductors weakness. We finished the hip examination. Thank you.